Hello, I'm Dr. Craig Childress. I'm a clinical psychologist in Pasadena, California. I work with children and families around issues of attention deficit hyperactivity disorder, parent-child relationship problems, angry, oppositional, defiant children, marital problems, things like that. In this video series, I've been discussing a particular type of parent-child relationship problem that I describe as a parental alienation dynamic. In this video segment and in the two that follow, I will be talking about the child's DSM-4 diagnosis. And in previous video segments, I've discussed the personality disorder of the alienating parent. It's narcissistically organized with borderline and paranoid features and gives rise to a persecutory delusional disorder regarding the inadequate and abusive nature of the targeted parent. From my perspective, it is the psychopathology of the alienating parent that is driving the symptom expression of the child. It is driving the psychopathology expressed by the child through an enmeshed psychological relationship between the alienating parent and the child. And I'll describe the nature of that enmeshed relationship in a separate video. And so the child's actions towards the targeted parent are actually a symptom expression of the personality disorder of the alienating parent that's being transferred through the enmeshed relationship to the child. Okay, so the child is expressing the personality disorder processes of the alienating parent. So the personality disorder processes first are the narcissistic core inadequacy. And what's happening with that is that's being projected over to the targeted parent. And so it is the targeted parent who is being defined as inadequate through the child's responses to the targeted parent. The borderline processes, that fear of abandonment, is being transferred over to the targeted parent, but consistent with the borderline processes, it's going through this splitting kind of process, whereby the alienating parent is the never abandoned parent. The child expresses that they want to spend 100% of the time with the alienating parent, and the child's hyper-idealization of that parent expresses and communicates this "I will never abandon you" theme. Okay, that they absolutely adore that parent and think they are just wonderful. Okay, so the "I will never abandon you" and "I want to spend 100% of my time with you" is the positive split on that fear of abandonment. The negative split goes over to the targeted parent, where the child wants to spend 0% of the time with the targeted parent. That the child is essentially abandoning the targeted parent. And so while oftentimes this alienation dynamic is expressed that the child is rejecting the targeted parent, probably more accurately is the child is abandoning the targeted parent. They want nothing to do with them. And that's the expression of that borderline process within the personality disorder of the alienating parent regarding the fear of abandonment. And so that negative side is being projected over to the targeted parent. The paranoid persecutory aspects of the personality disorder are being expressed symptomatically by the child in the child's justification for their hostility. And what you will see with that regard is the child presents with a sense of entitlement regarding the relationship with the targeted parent. And they sit in judgment of the targeted parent with this sense of, I deserve the targeted parent to treat me as if I'm just hyper special. And then, for no particular reason, the child determines that the targeted parent has not met those entitled self-expectations. And so therefore the targeted parent deserves to be punished, deserves the hostile treatment by the child. And so there's a presentation by the child of being superior to and sitting in judgment of this inadequate parent. And in that process, what the child communicates is that the targeted parent is, through their inadequacy or through their actions, is treating the child badly, that they're being abusive or neglectful of the child, of what the child's entitled to, and therefore deserves the treatment of the child, the hostile negative punishment of the child. And indeed, the child sort of acts as if they're punishing the parent for being inadequate. And so that perception of the parent as being somehow abusive to the child and therefore meriting the child's angry, hostile response is an expression of that persecutory, paranoid kind of process with that. And sometimes the child will actively make allegations that the parent's abusive towards them. And they will go back and make those, and supported by the alienating parent, who will then activate some sort of abusive investigation. And so the child's psychopathology in this situation is actually a manifestation of the alienating parent's personality disorder features. The hostility and the angry and the viciousness of the child's treatment of the targeted parent also, as you explore this, and I'll talk about this a little bit more in the next segment, has the underlying feel of a domestic violence process. The child is actually being abusive towards the targeted parent. And that's sort of an expression of the hostility, the domestic violence process between the alienating parent and the targeted parent. The targeted parent provoked a narcissistic injury in the alienating parent and provoked that fear of abandonment in the alienating parent by not supporting the narcissistic inflation of the alienating parent, and by actually leaving, divorcing, but by also being psychologically separate from a fused state with that alienating parent. I'll describe that elsewhere as well. And so the targeted parent provoked this narcissistic injury and provoked this fear, this persecutory, paranoid kind of fear kind of place, and abandonment kind of fears in the alienating parent. So that the response of the alienating parent is one of narcissistic rage and sort of a borderline angry, that the targeted parent deserves to suffer. And that's the fundamental presentation of the alienating parent in that interview, is that the child's hostility towards the alienating parent, or towards the targeted parent, is justified, is warranted. The targeted parent deserves to suffer. And that's the domestic violence process that underlies the child's symptoms of tremendous hostility and aggression, sort of an instrumental aggression towards the targeted parent. In typical parent-child relationship conflicts, you'll see angry. Okay, so you'll see sort of the child wants a relationship, is feeling hurt or frustrated in acquiring that relationship, and it's out of that hurt and frustration that the child is expressing some angry. What you see in the alienation dynamic is you don't see the hurt, and you don't see the child wanting the relationship. What you see instead is the hostility is sort of an instrumental act of aggression. The child is very cold and calculating and mean. It's an instrumental act of aggression that's born out of this personality disorder processes with the alienating parent to induce suffering, justified suffering, into the targeted parent. And that's the domestic violence kind of theme that kind of underlies some of this. So in the next video segment, I'm going to be talking about how to recognize this process and what diagnoses are warranted by this process.